Welcome to Trial Site News Roundup. Today at our program, we'll be discussing two stories. The first from Mexico, where a Mexico City-wide innovative population-level study administered ivermectin-based home kits with drastic reduction in hospitalizations. Now, we're going to go over the details of this study. Then, Uttar Pradesh health officials go on record saying that ivermectin as prophylactic use has lowered COVID-19 infection rates and death rates. We'll discuss the situation unfolding there. And so, from Trial Site News, I'm Adrian, and the News Roundup starts now. So the nation of Mexico generally, and more specifically Mexico City, one of the world's most populated cities with 22 million people, experienced a greater spike in COVID-19 cases by December of 2020. The Mexico City government, concerned about hospital capacity, implemented an expanded population-based health intervention to manage COVID-19. This, based on the growing data available from ivermectin research, the government organized a pre-hospital home care program combining early detection with antigen tests, a phone-based monitoring process for positive patients, and the provisioning of a medical kit containing ivermectin. Now, taking a step back to earlier in 2020, testing for this was based on the World Health Organization recommendation and was extended into a massive testing program in 230 temporary mobile units or kiosks. The goal was to lower access barriers to identifying COVID-19 at early stages, reduce opportunity for transmission via home isolation, and care for patients early, right at onset, even if asymptomatic or mild symptoms. The overall study commenced back in July of 2020, with 3,000 tests administered daily, and by the middle of November, the government expanded capacity to 24,000 tests each day. Public health workers followed up on those deemed positive via Locatel, Mexico City government call center or WhatsApp text service. During that call, patients were informed if they were positive, asked if they can be in isolation, and the symptoms. If escalated, prompt a more intensive monitoring protocol every couple of days in more severe cases, and serious cases prompt a 911 and hospitalization. Now, moving forward to December 28th of 2020, the ivermectin-based medical kits were distributed to mild to moderate symptomatic patients. The Mexico City government sought to measure the effectiveness of this population-wide intervention, inclusive of the ivermectin-based medical kit in overall hospitalization during the pandemic. Using a quasi-experimental research design involving a Coarsened Exact Matching method, leveraging hospital and phone call monitoring data, the study team estimated logistic-regression models with a range of observational data and found a significant reduction in hospitalizations among the cohort receiving ivermectin-based medical kits. Now, the range of positive effect totaled 52 to 76%, depending on model specification. The team concluded that ivermectin-based interventions in a well-designed population-level scheme mitigates the effect of the COVID-19 pandemic on the health system in the world's fifth largest city. Now, we believe that these results should trigger public health discussions in other large metropolitan areas. It is also worth noting that this study included over 200,000 people. Now, the Mexican City news was covered in various press and on YouTube interviews, but was not widely translated in the rest of North America. Now, Dr. Vincent Mondragon explained how and when the Mexican IMSS started using ivermectin. Population health professional Juan Chami reported to Trial Site News that the IMSS was using ivermectin in the early stages of COVID-19. Now, IMSS, which is a government health plan, is used by about half of the Mexican population, which is over 60 million people. So now let's take the study research centers and agencies involved. The study was led by professionals in a number of agencies, which include Mexico City Digital Agency for Public Innovation, the Mexican Social Security Institute, or the IMSS, and Ministry of Health Mexico City. It is also worth noting that the IMSS helped sponsor this population-wide study across Mexico City. And as a governmental organization, they assist public health, pensions, and Social Security in Mexico operating under the Secretariat of Health and forms an integral part of the Mexican healthcare system. And so, with the Mexico City study team generating what appears to be compelling results in that they reduced the pressures on hospital systems, these results led to the confident conclusion by those involved in the study that this population-level ivermectin-based intervention in fact worked quite well, materially lessening hospitalizations, reducing suffering, and undoubtedly saving lives. And so, we here at Trial Site News must ask the question, why aren't the press in both the United States or Europe picking up on such an interesting and compelling story? Now, for this next story in the news roundup, we'll be shifting to Uttar Pradesh, where health officials are now on record claiming that ivermectin as a prophylactic has lowered the COVID-19 infection and death rate. Now, currently, here in the United States, official U.S. guidelines from the FDA and the NIH as of this filming are still as follows. First, the FDA has cautioned against the use of ivermectin for use against COVID-19, saying they have not approved ivermectin for use in treating or preventing COVID-19 in humans. The FDA also has added a notice about the use of the animal version of ivermectin, saying that one should never use medications intended for animals on yourself. Ivermectin preparations for animals are very different from those approved for humans. Secondly, the NIH, which has a softer stance on the subject of ivermectin with a more neutral tone, neither for nor against the use of the drug, say that there is insufficient data to recommend either for or against the use of ivermectin for the treatment of COVID-19. They say that results from adequately powered, well-designed, and well-conducted clinical trials are needed to provide more specific evidence-based guidance on the role of ivermectin in the treatment of COVID-19. Now, back to Uttar Pradesh, which is the most populated state in India. They have declared that the use of ivermectin as a prophylactic and therapeutic has not only lowered transmission and infection rates, but have also served to reduce the COVID-19 death rate as well. Now, it has been a year since the first cluster of 5 cases was reported in Agra, and recently the health department has shared positive results with the ongoing program. Now, recently we reported that ivermectin has been included in the national COVID-19 guidance due in part to positive outcomes which are now emerging. Now, the Uttar Pradesh Health Department shared recently that it also has plans on conducting a controlled study once the second wave of the pandemic wanes. Now, we here at Trial Site News are reaching out to health authorities in Uttar Pradesh to learn more about the observational data behind the initial rapid response team study. And of course, we will keep you posted on that story as it continues to develop. And that, my friends, brings this episode to a close once more. As always, thank you so much for joining the program today. From Trial Site News, I'm Adrian, and I will see you all next time.